Baltimore, you can check it out on Channel 13. And we'll also be doing live cut-in interviews between 4, 5, and 6 p.m. Also, right here on Facebook Live, we're joining from Dr. Stan Brull of the Krieger Eye Institute about some many things that you can do about dry eyes. So if you have a question about dry eyes, please post it in the comment section below. If we don't get your questions right here on Facebook Live, you can submit a question through our website. You can answer it right there. The address for that is languagehealth.org/askexpert. Welcome, doctor. How you doing? Good. Can you explain what GED is?
She's so excited at what she's going to do. Because if we're not going to cataract one eye that doesn't do well, she'll get out. I got that right. She was like, why?
How would someone know this is So with some questions coming in, Kimberly is asking, is Visine okay to use by eyes?
Well, Visine is I can tell you, primary doctor so, Visine takes a
Let's see if we can.
Half hour.
Not sure. So I'm not sure if your last question was answered properly. If you could be hearing it, but just a reminder that we are here at WJZ for our Facebook Live series for our Krieger Ask the Expert. I'm here with Dr. Brull, and now we're back. I think we can hear you now.
Okay.
All right. So let's just go back and that last one about the symptoms of dry eyes and how do you know if you have it?
Okay. As I said, the symptoms are quite variable, and they can range from the obvious symptom of the eyes feeling dry or scratchy to itching, burning, and even tearing. Sometimes vision is blurred as well. And a logical response to that answer is, well, if my eyes are tearing, how can they be dry? But the tearing actually occurs because the dryness has reached this point where it is effectively set off a reflex where the eyes tear if so much that the tears run down the face in an effort for the body to respond to a noxious or a painful stimulus.
And it looks like we have a question. It says here, is sustained balance good for dry eyes? My eyes seem to float daily.
Sustained balance is one of the common artificial tear preparations that's absolutely fine. There are many, many products available, and I don't know whether the Visine question came through or not,
okay.
But oftentimes I'm asked whether Visine or Murine are good to use for dry eye, and as I indicated previously, these products have a vasoconstrictor, so therefore their use should be limited. Using vasoconstrictors of any kind, nasal drops for constricting the vessels in the nose, have been known to cause long-term problems, so that's to be avoided. However, both Visine and Murine are available as Visine tears and Murine tears, and they will have, under the name, the indication that they are lubricant eye drops. Many products, they all have this indication. If that's written underneath the brand name, then you're safe to use it, and you can use them as frequently as you want. There is no overdosage.
Okay, and looks like we have some more questions coming in. This one's from Christina. She uses her computer all day, and her eyes burn after using her computer. Is that dry eyes?
Very likely it is. Exposure to the computer is not dangerous in and of itself. The light coming off the computer or the rays coming off the computer are not damaging, but concentrated visual activity is associated with a decreased blink rate. That is, when we're reading or when we're looking at text on a computer, we tend to concentrate more, and therefore our lids don't blink up and down as frequently. When that happens, the eyes are more exposed and they tend to become dry. I generally recommend, I don't advise quitting your job, Christina. I think a better idea would be to have some drops, sit them right by your computer, and every half hour or hour that you're at work, kick back and put a drop in, and you'll find it'll help you out remarkably.
Okay. And just remember, right here on Facebook, if you want to submit your comments in the comments below, we'll try to answer those questions for you. If we don't get to all your questions, we'll make sure we put them on the website, which is lifebridgehealth.org/asktheexpert. Is there anything that you can do to avoid getting dry eyes?
Sure. I guess in an ideal world, if you could live in a very rainy climate and not read and not grow older, and not be of female sex, then maybe you could avoid it. But okay. Those are all predisposing factors. Dry climate, dry atmosphere, air conditioning is hard on dry eye. And using your eyes for, as I said, concentrated activity, all tend to be risk factors. None of them are dangerous, none of them are bad, but they all tend to make the symptoms and the disease a little worse.
Is another question here, can DED affect my vision either temporarily or permanently?
That's actually quite possible. If the disease progresses to the point where there are irregularities in the corneal surface, you can have temporary, in that they can be treated, or permanent effects if the treatment is not totally successful. So it's a good thing to keep after this disease and to do your best to manage it and to be under the care of an ophthalmologist who understands and will act proactively for treating. And I think I might mention, because I don't see it in any of these questions here, but there are some comorbidities with dry eye. The most noticeable one, these are diseases that go hand in hand with dry eye. And one of them is blepharitis, or inflammation of the eyelids. Many people have been diagnosed with blepharitis, and although dry eye can be associated with aging, and I don't mean old, just aging, blepharitis is actually a disease that many young people have, and it is associated with an inflammation of the eyelid margins, oftentimes to the point where you get a chalazion or cyst forming the eyelid, which sometimes is called a sty, but is not really a sty. And patients who have blepharitis are prone to dry eye because the glands that are affected in blepharitis produce the outermost layer of the tear film, which is actually a lipid or fatty layer. You can imagine that if the tear film were simply saline, simply water and salt, how quickly it would evaporate. This layer of fat on the top of the tear film actually keeps it from evaporating quickly. So when the glands that produce that fat, the meibomian glands in the lid that are affected by blepharitis, when they function abnormally or less than ideally, this often aggravates dry eye, and that can be seasonal. Oftentimes blepharitis is seasonal. Cold weather, especially changing to cold weather, tends to make it activated, and it can be a disease that waxes and wanes for a lifetime. So that's something to just be aware of. Also, to be aware of the fact that certain medications can decrease the tear production, notably antihistamines, whether you take them by mouth, like Claritin or Zyrtec, or whether you put in an eye drop that's an antihistamine. Any antihistamine will tend to dry the eyes more. So this means if you have been diagnosed with dry eye, you should use your dry eye therapy more frequently when you're using an antihistamine.
What about makeup and stuff? Does that affect dry eyes?
I don't think so. I don't think
Okay.
makeup itself affects dry eye, not if it's properly applied.
Okay.
I only use the minimum amount myself.
Another question that came in is what causes dry eyes, and can it be genetic?
I don't know that there's a genetic element, although I think the reason I don't know it is because it's unknown. And as far as causes go, as I said, it's associated with aging due to changes in hormones, and for some reason or other, female patients have greater incidence, although there are plenty of men with it.
Okay.
It is more serious or more severe and more common in the Asian races, and it is more common with aging. So those are three associated factors. I wouldn't necessarily say they're causes, but they are associated. There are some systemic diseases. I mentioned the medications, but there are some systemic diseases, that is, diseases of the body, not blepharitis, which is a localized disease. But there are some systemic diseases, specifically autoimmune and connective tissue diseases, that can be causes of dry eye as well.
For DED, is surgery recommended?
Very rarely. In really refractory cases where the corneal surface is damaged to the point where there is a neuropathy, where the nerves are sending pain messages to the brain constantly, there is a permanent closure of the tear ducts that can be done. But that's only in extremely severe cases. There are other more invasive things that are not surgery, but that require, say, laser treatment to the lid glands, or manual expression of the lid glands, which is something that is not a very comfortable thing to have done. But no, surgery is really an endpoint.
Okay. And also, how long does it last?
You know, that's a good question. I have never known anybody who recovers from dry eye disease. First of all, it's mostly a disease of older folks, and older folks don't get younger. Um, but there are young people who have episodic um, problems with it that come out of it and then can go for a long period of time before needing to use therapy again. So um, it's not a fatal disease,
Okay.
but it is more or less a lifelong problem, even though it can be better at sometimes and worse than others.
All right, got some more questions coming in. If you wear contacts, are there certain types of drops or ways to handle dry eyes?
Well, you know, that's a really good question because I didn't mention contact lenses. Contact lenses are a known um, negative in terms of dry eye. That is, they can actually aggravate the disease very, very noticeably. And I've often encouraged contact lens wearers to use something called re-wetting drops, which are basically artificial tears that are compatible with contact lenses. And they're available over the counter in the drugstore. And I can't emphasize too much what a great idea that is if you're a contact lens wearer. I don't disparage contact lens wearing at all. I think it's important. And contact lenses in severe cases of dry eye are sometimes used as therapy. So, yes, get re-wetting drops and use them as often as you can.
Great. Well, I think that's all for right now. So thank you for joining us today, Dr. Stan Brull from the Krieger Eye Institute. Just a reminder that if we didn't get to your questions, we'll try to answer them right here on our website, which is lifebridgehealth.org/asktheexpert. And again, thank you for watching. Be sure to like us on our Facebook page and follow us on Instagram. And again, if you're in need of eye care, be sure to check out the Krieger Eye Institute. The website is lifebridgehealth.org/KriegerEye. I'm Tom Gill for LifeBridge Health, and we'll see you next time. Thank you.
Thank you.